Okay, hi. So what we're going to do is talk about now is how to stretch this posterior hip capsule. Okay, so in runners with posterior hip capsule tightness, or just athletes in general, when you bring your hip up, there's a tightness. You'll get pain in the glute, pain in the front of the hip. You get kind of a pinching when you bring your hip up, and that's really tightness here in this capsule. What happens is in the hip, that capsule goes all the way around the joint, and it's really to provide stability for the hip. But what it has to be is it has to be stable, but also equally flexible. So when you bring your hip up, that axis rotation in the hip joint stays in the center. And what happens is that back of the capsule gets really tight. So when you bring your hip up, that hip migrates forward in the joint, and then it starts pinching the front of the hip capsule, the front of your hip flexor tendon, and that's what gives you that little pinch when you bring your hip up. Okay, so we're going to talk about how to mobilize that. So what you can do is you're going to get a yoga strap, so non-elastic strap. I prefer the 8-foot strap, and maybe on your back, you put so on my right side is my affected side. I'm just going to put the strap right around my heel, and I'm going to keep slack on that strap and just put it up on my hip like this. Okay. Now from this position, what you're going to do is you're going to bring your affected leg, thigh, all the way up as close to your chest as you can. Okay, until you feel either bind or you get any type of pain. Okay. Now you bring it up to the point of pain or tightness. And from here, you take your opposite leg, and that's when you apply downward pressure on the strap. So that takes the femur and glides it posteriorly, so it doesn't want to ride forward and pinch you in that joint. So once you have that strap pulling that femur posteriorly, now you're going to do your glide. So what you do is now you're going to approximate the thigh to your stomach, 3-second hold, keep that tension on your opposite leg the whole time, relax here, again 3 seconds, up, and you do 30 reps in a row. But the key is that when you bring your hip up, you always keep it in the middle, don't let it go to the outside. Don't apply this downward pressure on your opposite leg until you've got your leg all the way up, and that's where you do your mobilizations from. Okay, so 3-second hold, 30 reps, both sides.